Hello all, this is Kemilawani back with just a short video. This particular one is in response to a comment I saw on Instagram under at Mom Confessions page. They were speaking of a particular child who has what was termed Klumpke's palsy. So I'll talk a little bit about birth injuries and talk a little bit from the aspect of prevention and from the aspect of treatment and management. For prevention, the main things are that you must ask to have your antenatal care supervised by persons with appropriate competency. So when you get pregnant is when you should actually start thinking of who is going to deliver this baby and take measures to be sure that your child is safe. Second thing is, if you do have things that predispose you to having big babies, such as diabetes in pregnancy, you should manage it actively. As a general rule, our women are predisposed to having diabetes in pregnancy, particularly as they get older. And so it's important to make sure that you have your blood sugar checked formally at around the 28 week mark. It's also important that you reduce your intake of carbohydrates. You do not need to eat so much for your baby, you just need to eat regularly for yourself in the first 3 months of pregnancy. In the next 3 months, you need maybe about a 10-15% increase in your diet. And towards the end of pregnancy is when you do need to eat a little bit more. But by that time, most women find that they can't eat as much as they like because they feel so full all the time. Okay, the other tip is that every child must be checked at birth to see if there are signs of a problem. And should you find that you think the child is not moving one arm properly, please come to the hospital immediately. Do not wait, because the earlier we start treatment for this sort of injuries, the earlier it is we can, get them back back to function. Again, there will be some children who actually would not move their arms, who may have had fractures. Those are some of the things we check in the hospital and see what exactly is causing the problem. And there is a very good, outcome for children who come on time, who do not have very complete damages. For children who have more severe damages to the nerves, the outcome is also improving, because now it is possible to operate on them earlier before the damage becomes so established that we're then just catching up with trying to improve the problem as much as possible. Okay, so that's a quick one on brachial plexus injuries or birth injuries. Do feel free to reach out, send a comment, send a message. If you do know any child with such a problem, regardless of the age, I am happy to see how I can help. And you'll be surprised that yes, we can actually still make some things better, even though they look quite bad